My church family, positive cases of the COVID-19 is still high in our county, and therefore we still remain where we were last week. As we enter into the flu season, it is very likely that flu viruses and the viruses that cause COVID-19 will both be spreading this fall and winter, potentially causing a twindemic.
If you had flu, if you had COVID, it's going to be really hard to tell.
Testing will help. However, with the flu season looming, many are worried about overlapping outbreaks.
I hope that the following discussions will help us to understand the similarities and the differences between the flu and COVID-19 viruses.
One of the things that's different is that COVID-19 is a brand new virus, something we've never seen before. It emerged in China in December of 2019, and none of us have any immunity to it yet. From the information that we have so far, COVID-19 is more deadly than the flu. In fact, it appears somewhere between 10 and 20 times more likely for you to die if you get COVID-19 than if you get the flu. COVID-19 appears to be much more transmissible than influenza. It transmits more easily from person to person than what we see with the flu that we see every year. And because of that, we need to take some special precautions to make sure that people don't pass it easily from one person to the next. With influenza, we have some treatments. We have some antiviral treatments that can be used. We don't have that for COVID-19. There's no FDA-approved treatments for COVID-19 right now. You certainly heard on the news that there are a lot of people working on those treatments, but there isn't anything that's been proven to work for COVID-19 now. We don't have treatment and we don't have a vaccine, so what do we have left? We have these community mitigation measures, like social distancing, like not being in mass gatherings, trying to avoid being around people who are sick, but now we know that even some people can spread COVID-19 when they're not sick. So it's important to follow all those instructions that you're hearing from leaders in your community.
There are some things that should be universally practiced, and that is the universal wearing of masks, avoiding crowds, keeping a distance, doing things outdoors more than indoors, and washing your hands frequently. That doesn't matter who you are. That's what you should be doing.
An annual flu shot has always been important protection for you and your family. Even though there's no vaccine for COVID-19, there is one for the flu, and it's safe, effective, and available. Getting a flu shot can keep you and others around you safe. It will also help our healthcare heroes focus on those who need critical care. Kids, pregnant women, seniors, and people with chronic illnesses are especially at risk. It's more important than ever. Go to fightflutogether.org to learn more.
The County of San Bernardino Public Health Department is offering every resident a flu shot at no cost. The department has established a medical point of dispensing sites throughout the county. For more information, visit the county website at www.wp.sbcounty.gov. Take advantage of the opportunity which is there and protect yourself and your families and your community from these viruses.
We will get through this, but we need to do these important measures now.